What is responsible parenting? It is the will and ability of parents to respond to the needs and aspirations of the family and children. It's a shared responsibility of the husband and wife to determine and achieve the desired number, spacing, and timing of the children according to their own family life aspirations. Taking into account psychological preparedness, health status, socio-cultural and economic concerns. Also, responsible parenthood doesn't limit only on fulfilling the demand of children and rearing them up properly but goes beyond that.
Number 1 is marriage should be done at the right age, as the right age of marriage helps to start a new life, new family, in a right time. Number 2, the size of the family should be decided by both parents together. Number 3, being responsible parents also refer to becoming parents at the right age where both of them are physically and mentally mature to start a family. And lastly, number 4, proper spacing between the births of children also necessary for health of a mother and child. This also assures that every child receives attention that they deserve.
First, we teach more with action and less with words. Various studies have proved that children learn from observing and experiencing the world than by thought words. Responsible parents provide the right example and behavior to their children to learn from. Instead of saying be polite, they demonstrate politeness by being polite in their everyday life. Second, they encourage more and criticize less. One of the biggest responsibilities of parents is to instill confidence in their children, and this can be achieved by being more encouraging and motivating of their children's strengths and good qualities. Constant criticism can rip the children of their self-esteem and demoralize them. It can take them into withdrawal mood and secretiveness, while regular appreciation helps in building strong, confident, and positive children. Third, they spend quality time with their children. Reports have suggested that when it comes to spending time with kids, we all would prefer an hour of peaceful, undistracted quality time with our loved ones over 4 hours full of distraction, divided attentions, and undue arguments. They spend quality time with their kids that helps in developing deeper bond of love and understanding between the parents and their children, and create their own ritual like the ritual of 2 minutes of mom meditation. They act as responsible individuals themselves. Like I mentioned in point number 1, children learn more from examples. Responsible parents behave responsibly in front of their children. As responsible individuals, they care for Mother Nature, be kind to others, practice honesty, and are authentic. Fifth, they encourage dialogue with kids. Encouraging dialogues with kids have twofold benefits. It makes them feel that they are important to have their opinions heard and help them in developing the art of self-expression. A lot of issues can be solved with open communication, and having a healthy, logical dialogue. Responsible parents listen actively to their kids and set it as a stepping stone to a relevant and useful discussion.
6. They stay connected as a couple. In a study done by Robert Epstein and Shannon Fox, they reported relationship skills as one of the 3 most important parenting competencies. According to the study, parents who show great relationship skills as a couple raise happier kids. Responsible parents behave like happy and connected couples to give good examples to kids. 7. They understand their kids' love language. Gary Chapman gave us 5 love language for kids. Responsible parents not only learn their kids' love language but also try to communicate with them in the same language. This helps immensely in addressing the children's needs directly and feeling any emotional need capping. 8. They let their children take their own decisions. Letting the children make their own decisions help them in self-discovery and in feeling important. It should begin at a young age, but at the same time, what decisions are left upon them depends on their age and maturity. Instead of allowing children to decide whatever they want, responsible parents give them choices and let them choose. Slowly, as their sense of judgment grows, this array of choice can be widened. 9. They emphasize more on moral values and less on materialistic things. Time and again, it has been proved that in the end, moral values stand taller than materialistic possessions. Responsible parents place more significance on values like honesty, kindness, compassion, and integrity, and less on materialistic aspects like grades, competition, expensive things, and grooming. They understand that a sound character goes a long way than a better grade. They take parenting easily by giving good memories. They do not follow helicopter parenting, and nor are they completely lousy parents. They are right there, raising better kids by giving them a happy home to live in. They create good memories for their children that often last a lifetime.
Family planning is the ability of individuals and couples to anticipate and attain their desired number of children and the spacing and timing of their births. It is achieved through use of contraceptive methods and the treatment of involuntary infertility. Family planning may involve consideration of the number of children a woman wishes to have, including the choice to have no children and the age of which she wishes to have them. These matters are influenced by external factors such as marital situations, career considerations, financial position, and any disabilities that may affect their ability to have children and raise them. If sexually active, family planning may involve the use of contraceptive and other techniques to control the timing of reproduction.
Abstinence. Pregnancy cannot happen without intercourse. Complete disengagement from all forms of sexual activity is the most straightforward measure of avoiding it. Birth control implant. The birth control implant is administered by a health professional. The doctor will inject hormones called progestin into the arm of the woman to prevent pregnancy for a few years. Birth control pills. These are packs of hormone medication ingested by females daily. Available in pharmacies, these hormone pills are designed to stop fertility. Birth control patch. It is a wearable contraceptive that contains estrogen and progestin. Once worn and absorbed by the body, the hormones thicken the mucus of the cervix to hinder ovulation. Birth control shot. A series of hormonal injections that prevent ovulation and thicken cervical mucus. These shots will only be effective if they are administered every 3 months. Birth control sponge.
A soft plastic inserted inside the vagina before intercourse. The sponge covers the cervix and prevents the sperm from reaching the egg. Birth control vaginal ring. It is a small flexible ring inserted inside the vagina that stops sperm cell from merging with an egg. Breastfeeding. Due to the secretion of specific hormones, women who are breastfeeding generally do not ovulate. Engaging in intercourse during this period under certain conditions will prevent unplanned pregnancy. Cervical cup. It is a small and soft device made out of silicone inserted inside the vagina. Diaphragm. Similar to the cervical cup, the diaphragm is a small, shaved device designed to cover the cervix. Internal female condom. It is a soft and elastic pouch inserted inside the vagina that creates a barrier against sperm. The outer ring covers the vaginal opening. Intrauterine device or IUD. It is a tiny T-shaped plastic device inserted in the uterus, and it is one of the most effective contraceptive methods. This device impairs the improvement of sperm cell within the vaginal canal and prevents them from reaching the ovary. Male condom. This tiny, elastic, and stretchable cover is one of the most common and widely available contraceptives. This is worn in the penis during intercourse to prevent the sperm from meeting the egg. Rhythm method, also known as the calendar method. This requires couple to abstain from sexual activity during the fertile periods of the female. Spermicide. It comes in the form of a gel or a cream that is applied to the vagina before intercourse. Usually paired with the other device such as cervical cup, this product contains property that eliminates sperm. Sterilization. It is a surgical procedure performed on females that can temporarily or permanently close the fallopian tubes to prevent ovulation. Vasectomy, a surgical operation performed on males that cuts tube inside the scrotum. This permanent contraception for men prevents sperm from leaving the body. Withdrawal. This is the process of pulling out the penis from the vagina before ejaculation, preventing sperm from reaching the egg during intercourse.
Pagdating sa main benefits ng family planning, unang-unang makikita natin na ito ay tumutulong sa gobyerno para ma-regulate ang populasyon ng bansa. It helps government to regulate the population. Having regulate is to manage the population, lalo na siyempre sa usapin ng overpopulation. And maraming paraan na ginagawa ang kaparaanan ang family planning method, like adding ng sexual education or sex ed sa curriculum ng mga kabataan para maaga pa lamang ay naging aware na sila sa sexual responsibility and consequences ng pregnancy or yung pagdadalang tao. Maging aware na sila dun sa mga bagay na yon, mga consequences na pwede mangyari kung sila ay mag-commit ng sexual activity. At napakahalaga din na maunawaan natin na isa sa mga benefits ng family planning, ang tulad ng bansa natin na may higit sa 100 milyong Pilipino na tao na nakatira sa bansang ito, ay yung makita natin yung family planning ay isa sa best way to mitigate the consequences brought upon by overpopulation. Meaning na isa to sa paraan na best na gawin natin para i-counter o labanan yung overpopulation. Ang bansa natin ay marami magpapakita na datos na higit kumulang na 200,000 out of 2 million births in the Philippines are from teenage pregnancies. Sabihin malaking porsyento, malaking bilang ng panganganak dito sa bansa natin ay nanggagaling sa mga kabataan or sa teenage. At napakalaki ng papel ng family planning dito, sex education dito, ay yung maibigay yung awareness para ma-prevent yung mga statistics na gaya nito. Sabi nga ay to prevent these statistics from rising, spreading awareness is the key. Aware sila yung responsibilidad nila, mga consequences, ay nandun yung opportunity na napaglabanan natin itong bagay na. In a household settings, family planning can bring about many benefits. Maraming pwedeng maging benepisyo ang family planning. Especially dahil mahirap magdala ng bata, hindi biro ito. Ang resulta o outcome na pwedeng mangyari, hindi lamang sa maiksing panahon, kundi pwedeng maging long term ang maging resulta nito kung hindi magiging handa ang tao sa usapin ng pagpapamilya. No? So, napakahalaga yung sabi nga ay planning a partner's pregnancy with the help of medical professionals will also help prevent health complication. Dito sa bagay nito, kung sila nakapag-family planning, papagandaan nila ay naiingatan din nila yung katawan nila, na kalusugan nila. Napakahalaga ng bagay na yun kasi kung hindi nila alam, hindi sila aware, hindi sila planado, ay hindi nila alam yung pinapasok nila, hindi nila alam ang kalagayan na magkakaroon sila at hindi nila alam ang gagawin nila. Kaya napakahalaga nung family planning. And from an emotional standpoint, family planning can strengthen the bond of a couple. Journey of pregnancy to giving birth in the delivery room is no easy feat, and the process of raising a child may be one of the biggest in a couple's relationship. Practicing responsible parenthood by planning together will undoubtedly fortify the union in the years to come. Kaya napakahalaga din itong family planning is magdating sa emotional state ng couple or nung nagsasama, bago sila magkaroon ng pamilya, malagay sa ganung sitwasyon, yung family planning will also can strengthen their relationship or solidify yung union nila, yung pagsasama nila. Marami sa panahon natin ngayon at ihiwalay, nagkakaroon ng breakup, yung bata nagsasuffer at marami pang iba ay dahil hindi lamang sila planado. Hindi nila pagandaan, yung financial nila, yung emotional nilang kalagayan, yung katawan nila, lahat and everything na pwedeng masok sa pag-uusap ng family planning, hindi na paghandaan. Kaya andun yung nangyaring kalagayan. Pero kung may family planning, it can also help the couples to strengthen their relationship. Kaya napakahalaga. At ilan lamang yan sa mga benefits or benepisyo ng family planning.